All right, today we're diving into something well, it's one of the most urgent challenges in medicine. We're talking about acute respiratory distress syndrome, or as you'll often hear it called, ARDS. Okay, let's just imagine this for a second. You're critically ill. You're fighting for every single breath. The doctors are pumping you full of pure oxygen, but it's not working. Your body is still starving for it. See, this isn't just a lung problem. This is a full-blown crisis. And that's the reality of ARDS. So, what is ARDS, really? Well, it's this incredibly life-threatening condition that comes on fast. The lungs get so inflamed, so angry, that they just stop working. Fluid starts flooding the tiny air sacs, and you're in respiratory failure. It creates this desperate situation where even standard oxygen therapy just can't get through. So, how does a crisis like this even start? The most important thing to get here is that ARDS doesn't just happen. It doesn't appear out of thin air. It's always a reaction. It's a devastating chain event kicked off by some other major problem happening in the body. And this brings us to a really, really crucial point. You can't catch ARDS from someone. It's not contagious. It's actually the body's own devastating overreaction. A great way to think about it is like collateral damage. The body's already fighting this huge war against a major threat, like a bad infection or a major injury, and the lungs get caught in the crossfire. The things that trigger this fall into two main buckets. First, you've got direct injury. This is the kind you'd expect, right? A direct assault on the lungs from something like pneumonia, COVID-19, or inhaling smoke. But here's where it gets really tricky. The second category is indirect injury. This is when the problem starts somewhere else entirely, like pancreatitis or severe trauma. And in fact, the single most common cause of ARDS is sepsis, a massive body-wide infection that can trigger this catastrophic lung failure from a distance. Okay, so what is physically happening inside the body during all this? Let's zoom in, right inside the lungs, and see exactly how this chain reaction leads to total failure. It all unfolds in this devastating cascade. First, that initial injury triggers massive inflammation, which damages the super delicate lining of the millions of tiny air sacs in our lungs, the alveoli. Next, that damage makes the tiny blood vessels around them leaky, and they start pouring fluid into those air sacs. So now the sacs are filling up like waterlogged sponges, and they can't exchange gas anymore. Then, because they're so heavy with fluid, they just collapse. And the final terrible result is severe hypoxemia, which means dangerously low oxygen levels in the blood. When you boil it all down, this is the core problem. The entire system is designed to get air and blood incredibly close, almost touching. But ARDS, it throws up this wall, this physical fluid barrier right between them. It completely shuts down the whole process of breathing at the most basic level you can imagine. And the fallout from this, it's immediate, and it ripples through the whole body. Without oxygen, tissues everywhere start to suffocate. That's what we call widespread hypoxia. The lungs have failed, and that kicks off this terrible domino effect. Other vital organs, the kidneys, the heart, they start to shut down too. And that leads to multi-organ failure. Okay, so the clock is ticking. How on earth do doctors figure this out? For the team in the ICU, spotting ARDS quickly is everything. It's an absolute race against time, like they're detectives searching for the telltale clues of this hidden crisis. The first clues are often pretty subtle, but they're alarming if you know what to look for. The patient starts breathing really, really fast. They feel like they just can't get enough air no matter how hard they try. You'll see them get restless and anxious. That's a sign their brain isn't getting enough oxygen, and their heart rate just skyrockets, trying desperately to compensate. But the real smoking gun, the one piece of evidence that screams ARDS, it's the chest x-ray. See, a healthy lung on an x-ray looks dark, right? Because it's full of air. But with ARDS, the lungs are full of fluid, and that fluid shows up as white. So you get this characteristic white lung appearance across both lungs. For doctors, that is a massive, massive red flag. So to be absolutely sure, doctors use this official diagnostic checklist. It's called the Berlin criteria. First, they confirm the problem started acutely, within a week of that first injury or illness. Then they confirm that white lung look on the x-ray. They also have to rule out other causes, like heart failure. And finally, the big one, they measure just how badly the lungs are failing at their job of getting oxygen into the blood. And that last point, oxygenation, they measure it with something called the PaO2/FiO2 ratio. Okay, don't worry about the name. Just think of it like a fuel efficiency score for your lungs. A high number is great, means the lungs are working well. But in ARDS, that number tanks. The rule is super simple. The lower the number, the worse the lung failure. And to score below 100, that means the patient is in a profound, life-threatening crisis.
So the diagnosis is confirmed. The clock is still ticking, maybe even faster now. This is where the real fight begins, an intensive, all-out battle to support the patient and literally win back every single breath.
And let's be crystal clear about this. There is zero ambiguity here. ARDS is a true medical emergency. It demands immediate, aggressive intervention in an ICU. So what's the primary weapon in this fight? It's the mechanical ventilator, a machine that literally breathes for the patient. But listen, it's not as simple as just pumping air in. It's an incredibly delicate balancing act. Remember, those lungs are already injured and super fragile. If you use too much pressure, you can actually cause more damage. It's like trying to inflate a balloon that already has a tear in it. So specialists have these really clever strategies. One is called PEEP. All it does is keep a tiny bit of pressure in the lungs even when the patient breathes out. This helps prop those floppy, fluid-filled air sacs open. Another technique that's surprisingly effective is prone positioning. And this is as simple as it sounds. They turn the patient onto their stomach. It's amazing, but just using gravity helps shift the fluid around and opens up parts of the lung that were collapsed, which can dramatically boost oxygen levels. But the ventilator, that's just one piece of the puzzle. This is a multi-front battle, right? So doctors are also throwing everything else they have at it. Antibiotics to fight the original infection, steroids to calm that raging inflammation, and diuretics to help the body flush out all that extra fluid. It's all about supporting the body through the crisis. And really, this gets to the heart of ARDS treatment. There's no magic bullet here, no pill you can take to just cure the lungs. The entire goal is to support the body. You take over the work of breathing, you support the other organs, and you essentially buy precious, precious time. You give the lungs a fighting chance to heal themselves from that initial devastating onslaught. Which leaves us with a pretty big question to think about, doesn't it? We've seen over and over that ARDS is a secondary reaction. It's the collateral damage from another fight. So maybe the ultimate frontier isn't just getting better at treating the lung failure itself, but in stopping it before it ever starts. How can we get better at treating those initial triggers? Sepsis, pneumonia, trauma, so that the lungs never have to pay this terrible, terrible price.